Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Dr. Minni Malhotra, a highly trained family medicine practitioner specializing in precision medicine based in Texas. Welcome to the podcast.
Well, thank you so much, Phil. It's really amazing to be here and talk to you.
Now, I know your patients call you Dr. Minni. Can I call you Dr. Minni?
Absolutely. Yeah, it's easier. Yeah.
I know that you practiced in India for about 10 years before moving to the States and practicing here. Could you tell us a little bit about, perhaps contrast India to the US?
Yeah, I practiced in India. I was an OB/GYN in India, so I delivered a lot of babies. I don't miss that, waking up in the middle of the night. The culture in India is very different. So you talk more to the family rather than to the patient himself. And sometimes the family wants you to hide things actually from the patient. They don't want the patient to get stressed out, so they take it on them rather than tell it to the patient. And you don't have to give a lot of information. As far as in India, you don't have to give them a lot of information. And there is also a difference that if they come to you, they treat you as an expert, so you have to know everything. So it's not like here that if I don't know something, I can go and research and I can tell them, okay, I'll get back to you. But in India, the culture is such that you're an expert, you should know a lot more. And the thing about family, knowing more about the patient than the patient himself or herself was very different. Communication was very different in the sense that I didn't have to explain a lot of things like I have to do here, which I like, because then it gives a lot of options to the patient to decide their care together with you. So that one part I really appreciate here. Because in India, it was all on you, like whatever you recommended, the patient did follow most of the times.
Are people in India a little bit more open to or experienced with the concepts of functional medicine, nutrition, and things like that?
So I have been brought up in India with, home remedies. Okay, so a lot of Ayurveda involved. So they were already doing a lot of alternative medicine there, which is kind of not alternative. It can be mainstream because a lot of people used Ayurvedic treatment. We used like turmeric. Turmeric is, only emerged in the last 10 to 15 years here. But as a child, I remember if I fell off a bike or anything, my mom would give me turmeric in milk to drink to heal. So if I had a cold, she would give me ginger juice and honey to actually treat my cold. So we went with a lot of those things, which we now here use as functional medicine with the supplements and everything. So people used a lot of those, ancient medicine in everyday life in India, and they still use it. And homeopathy is very big in India too.
So when you got here, you changed your practice. You were no longer delivering babies?
No, so I did family medicine because then I had the option that I could still do some OB if I wanted to, but I didn't go that route. I didn't do OB because of, I had done so many years, and I really liked family medicine in the sense you were involved with the whole family as a whole, and actually gave me a more deeper meaning. And I could still use my knowledge of OB/GYN to help my patients in family medicine.
When did you get introduced to A4M?
So that's a very interesting story. So when I moved to Texas after a couple of years where I was working for a school district, I actually met this very interesting lady here in Spring, and she's a Vietnamese and she owned a big practice here. She had several clinics, and she wanted me to, get a kind of a niche in her practice. So she wanted me to do hormone therapy. So she said that, we must go to this conference. It's in Las Vegas. And this was back in 2014 when I attended my first A4M conference. And we went there and she said, oh, just attend the conference and start prescribing. So when I went to the conference, I was just blown away. I was blown away with everything because it changed my whole perspective. I was into a lot of lifestyle medicine myself because I struggled with my health right from, when I was in high school. So we have genetic obesity in my family, and we just don't have to eat food. We just have to look at it, to get fat. So it was really hard for me to maintain my weight. Nobody diagnosed me with polycystic ovarian syndrome. I self-diagnosed myself, and I actually went through all that journey alone. So when I went to A4M and I attended all those lectures, and I just came back so excited, and I really wanted to use that in my practice. So I spoke to my boss, my then boss, who actually introduced me. But she said, oh, what are you going to do with all this? Don't do the fellowship. It's of no use. Just learn how to prescribe hormones and just give hormones. So, for me, it was very hard to go that route. I had to know everything about, it was not just hormones, and it was so many other things they taught us there, that how everything has to be in place before even your hormones will start working. So I started my fellowship, a couple of years later, because it took me a year later, it took me that much time to actually decide to go into a fellowship, because my job was really demanding in the conventional side. We saw up to 30, 40 patients a day some days. So it was a lot of work. And I was not getting, anywhere with the patients. I was not getting any results. And if I counseled them, people didn't want the counseling, and insurance companies didn't want to pay for the counseling. So they didn't want me to counsel them because they said that, oh, we'll get a bill. So I continued the counseling part, but it was very hard to incorporate the functional medicine part. So then I started my practice on a part-time basis, just doing it after hours and including Saturdays. And so I did that for a year and a half, 18 months, and it was very hard. I just could not, because sometimes the patients would come and tell me that, hey, doc, let's not talk about my weight today because I got charged $60 for talking to you about it from my insurance company. And so then I decided, if I cannot get anyone better, and every 6 months, if I have to just renew prescriptions, that's not what I want to do. So that's how I got into functional medicine. That's how I started my journey. And I just love it. I mean, I just love hearing the stories of my patients and how they're getting better.
So yours now is a cash-based practice primarily?
Yes, so mine is a completely cash-based practice where we practice the whole gamut of functional medicine. We do IV therapy, and I also do homeopathy. So I'm getting certified in homeopathy too. So I've added homeopathy. I also do neurofeedback, and I am trained in doing, some aesthetics, but it's not a big part of my practice.
You refer to yourself as a lifestyle architect and wellness mentor. Tell us a little bit about that.
So I developed a methodology called as Dr. Minni's methodology, and my pillars of that methodology was COPE, C-O-P-E. So that was cellular detoxification, optimization of hormones, and performance nutrition, and enhanced mind mastering. So what I discovered was I had learned a lot from conventional medicine. I didn't want to throw it out of the window. So that was a platform to learn about the disease process, but it didn't give me the cure. So I added functional medicine, where I got to the root cause, more deeper, cellular. But then I was seeing that people had challenges. They had blockages in their mind. So I trained in neuro-linguistic programming, where I could help people remove those blockages, remove those challenges. And my transformational coach actually helped me become a mentor by identifying people's mind and what challenges they have in their minds, what beliefs they are actually keeping, what are their identities and their subconscious values, so that I could actually help them change their beliefs so that they could get success. So that's how my whole program is based on, is a lot of coaching and mentoring goes into it. So
the patients who come to see you, are they presenting with symptomology, or are they just looking for a wellness approach? preventative approach to their healthcare? Give us an idea of your patient population.
So 20% come for a wellness approach where they have just been diagnosed with something, like they're not experiencing anything, but they've been told that they have pre-diabetes or they have some autoimmunity, but no symptoms at all. So they want to prevent it from progressing. But 80% are people who are really looking for help. Like they've tried everything, they're frustrated, they feel hopeless, they feel like giving up. They've been to numerous specialists, conventional medicine, they've tried everything, and they just haven't got the results, and they're getting worse. So 80% of the population come to me who are in that shape, and 20% I would say come to prevention. And so there is a lot of work still to be done, where people start coming in the beginning before it really gets to that point where you really have to do a lot of work.
Do you employ a food first approach with your patients?
Yes, absolutely. So nutrition is very, very important. And nutrition is, I have a health coach also who works with me. And I did do the fellowship with A4M, which taught me a lot about nutrition. So I actually customize nutrition plans. So I work a lot on the nutrition aspect. So I customize it to the genetics, to the metabolism, and also to their hormones. Because if you have insulin resistance, or you have high cortisol or thyroid issues, your nutrition can shape a lot of your disease. And so I work on a lot of nutrition plans, real food, and also if they need supplementation, I add that too.
So could you give us an example of a success story or two, perhaps two different types of success stories where you were able to employ functional medicine techniques and see somebody actually improve and get to the root cause and solve the issue?
Absolutely. So, I often work with people who are 35 years and older, who are really struggling or starting to struggle with their health, and they've tried everything. They've been to doctors, put on prescription medications, and they're losing hope. And they just feel that they're going to be resigned to their health concerns. So that's exactly where I met Stacy. Stacy was a lovely person, a bubbly personality, and she was doing everything possible to reverse her health conditions. She was going to Orange Theory Fitness like 6 times a week. She was, working out at home too. She was monitoring her food. She was eating really healthy per her terms. But unfortunately, she just could not figure out what was going on. So with Stacy, we used, we actually found out that she was suffering from celiac disease and Hashimoto's by doing a lot of advanced functional testing, which she never knew. And she actually didn't believe me when I told her. She says, no, I don't have celiac. I don't have any reaction to wheat or gluten. So then I asked her, do you get a rash? And she said, yes, I get a rash all the time. So we started looking into her foods, and we found out that whatever she was considering as healthy by food sensitivity were actually harming her body. So we removed that, we altered her nutrition, but there were other things that were weighing her mind down. She was not confident, she had low self-esteem. So we helped her in those, actually figuring out what were the right steps, and we helped her and supported her in those steps so that she finally reversed her health in getting, like she was having brain fog, losing hair, gaining weight, and where she became energetic. She lost 40 pounds. She actually reversed her autoimmunity, and she was in the best shape ever by eating the right foods and by working out even less. So that was Stacy's story, and which was really took a turn by just applying the principles of functional medicine. I also had a lady by the name of Lynn. She had a bad family history of heart disease. So her father died when he was in his 40s, and her mother died when she was in her 50s. She lost her brother. So she was really, really afraid of, getting heart disease and actually dying from that. So when she came to us, she was really healthy. She was eating healthy foods. She had done a lot of testing on her own. Like she had done all the food sensitivities, micronutrients, she had done her genetic test, she had done all of those. But she hadn't been to the right practitioner who could actually figure out what was the meaning of those tests and how to analyze it and put it in perspective so that she could have a lifestyle or a blueprint which could actually help her prevent those diseases. So we actually went through all those detailed tests. We figured out what was her genetics, what was going to promote it. We figured out what were the lifestyle factors that could have turned on that gene, and we helped her create that lifestyle. We helped her with her nutrition, which was really good, but just needed a few things to be changed. And we found out what she was deficient in, which we corrected the deficiencies. And she had even a family history of Alzheimer's. So she was very afraid, and she did have the ApoE gene, so E4. So we actually helped her turn off those genetic genes and promoted her health in a better way. So she prevented all those things that were running in the family. So the whole moral of the story is you can be born with bad genes, but you don't have to live with the genetic diseases that it can cause. So like they say, predisposed is not predestined. So your genes are not your destiny. So that proved it with Lynn. So those are my two, different patients, one who was really sick and one who was healthy but was preventing a disease.
Yeah, thank you for that. So we're in the middle of COVID still, probably month 8, I guess, here at this point, or 7. Have you pivoted to a lot of telemedicine at this point in your practice?
Yeah, so previously before COVID, we were like 95% in person and 5% on Zoom or anything. But now we are like 60 to 70% virtual and 30% on one-to-one, one-on-one. So even my patients who are local, they prefer to do Zoom appointments and Zoom calls, and it's been working really well.
What do you find are some of the challenges of telemedicine?
Basically, I feel sometimes that connection is, sometimes not there when you see the person one-on-one and you can see every expression and how and that seeing each other, I feel that social connection is sometimes missing. But other than that, I feel you can still get them great results, even if from remotely.
Well, it sounds like you have a very progressive practice. Do you enjoy practicing medicine this way now?
Oh, yes. So every day I wake up and I feel like going out and changing lives. I feel blessed that I've been given this opportunity, to serve people. So this is really my passion, that I really want to change as many lives as I can in this lifetime. And also changing those lives will change so many lives they are connected with.
Yes, it's really the whole family, and then becomes generational because those values get passed down. Thank you, Dr. Minni. We really appreciate you joining us today. And hopefully we'll see you soon in one of the conferences or at a AFRM fellowship in 2021.
Thanks, Phil. I'm looking forward to meeting you soon, and I really enjoyed myself. Thank you.